We are back on Morning Line. Thanks for joining us. Allison Fields, veterinarian, with us this morning. Nice to have you on, Allison.
Thanks.
Always nice to see you. The number's up on the screen, 737-7587. If you have a question or comment for the vet, let's go to Becky. Hi, Becky.
Hi.
Hey, how can we help you?
Well, I have a cat question and a dog question.
Sure.
I have 3 cats and 3 dogs, and the one cat, she's a 7-year-old female. She started licking herself raw and licking her hair away, and I attributed that to I changed her wet cat food. And so since then, I've bought better quality wet cat food, the Blue Buffalo, but she's still on her dry, the same old that I've always bought, which is Imes, and I didn't know if it would be best to switch her back or switch her over to dry Blue Buffalo, so it's the same kind of stuff, if that even matters.
Usually what you're describing isn't a case of a food issue. You might want to take her into the vet and see what's going on. If sometimes it can be fleas, sometimes it can be stress.
It's not fleas, and it's actually gotten better since I've switched her.
Okay, good.
The thing, so.
I don't know that it's going to matter. Sometimes they will do these kind of cyclically as well, but if it's getting better, then I just keep doing what you're doing.
Okay, and then the dog question is, I have a 17-year-old American Eskimo, and she's on several medications, and one of them is meloxicam.
Uh-huh.
And our vet did tell us, it's just, I can't remember, that when things start to go bad with her, because she has a bad spine, although she doesn't act like she does, but when we have to put her on prednisone, we have to take her off the meloxicam. And how many days do I have to take her off the meloxicam before I can give her the prednisone?
Well, first of all, it's about 5 to 7 days that she needs to be off of it. But there's some other stuff that you could probably add into with the meloxicam instead of switching over to prednisone, such as tramadol, gabapentin.
She's on both of those too already.
Oh, she's on all 3 of those.
Yeah.
To be completely honest, I don't know that you're going to get that much more relief for her on prednisone, but you could try it. But yeah, it needs to be at least 5 to 7 days.
Okay. Well, she doesn't need it right now. She hasn't got the memo that she's got a bad spine, so all is good. But I just couldn't remember what our vet had told us about that. So I appreciate it. Thank you very much.
Yeah, no problem.
Thanks. Wow, she's wired in there with the meds and everything.
17 years old. That's great.
Wow. What the drug she was talking about treat what type of condition? Arthritis. And when she's saying that the dog doesn't have doesn't know about the bad spine yet, that it's been diagnosed, but the dog's not in pain yet,
She probably was in pain at some point, which is why she's on all these meds.
Okay, I would think. And that just comes.
But the meds are keeping her happy.
Okay.
And yes, that just comes with age.
Yeah, I was going to say, Mashed Tater is not on any of those, but whatever injury she suffered when she lost her front paw and her back, you can tell is a little. And the vet, we've had a look at it. The vet had given us very low doses. So it's an opioid, I think, of whatever. I don't know what you give dogs to take pain away, and we'll give her just a very tiny little splurt of that every once in a while if she seems extra stiff and kind of. Boy, it does wonders. She digs that stuff. I mean, not that she craves it or anything, but what is it you give them for painkillers? This is not one of these.
There's a lot of stuff.
Yeah, but it's I don't know if it's an opioid or what it's extract from, but it's a prescription painkiller.
Yeah, we have a lot of those.
It's in a little syringe that we pull out of the bottle, and we just give her a little bit and just, and man, it really takes the pain away.
Good.
She'll move around a bit, but it's not curing it. That's just going to get worse, right, with time. Ah, poor little doggy. All right, let's go next to Lamina. Hi, Lamina. Lamina?
Yeah,
hey, go ahead, ma'am.
I have an outdoor dog, and of course, he has gotten his winter coat. But with the temperatures falling, I've been bringing him in, and I'm wondering, how do I balance out having him in versus having him out so that he doesn't lose his winter coat?
Well, if he's an outside dog and he spends most of his time outside and you're bringing him in like at night, he's not going to lose his winter coat because he's still outside enough to keep that.
Okay.
Yeah.
I mean, if you brought him inside and never let him outside again, he'd probably lose his winter coat. But,
right.
Even indoor dogs get a winter coat because they're going outside to potty, and the change in the light and the sun and the seasons, they all get a winter coat. It just depends on the depth and the thickness of that winter coat as to their exposure.
Okay, I was concerned that with him being indoors, that he might start to shed his winter coat, and that had me concerned because he is an outdoor dog, but like I said, I've been bringing him in
Sure.
on the lower temperatures.
Yeah, I think he'll maintain that coat just fine.
Okay.
That's a good question. You know,
Yeah.
that's interesting. But you're right. It's almost it's built in instinctually. Not that it kicks in, but dogs are going to get when those conditions you just said, shorter days, less light, cooler temperatures in general. That just kicks in,
It does.
whether they're indoors or outdoors
And
at
your
all.
indoor, like if you have let's just say an Akita.
Yeah.
You know, your indoor Akita is probably not going to get the same winter coat that your outdoor Akita is going to get. But everybody who has an indoor Akita knows full good and well that in the springtime they blow their coat and there's like another Akita running around on the floor of your house because they got their winter coat too, even though they're an indoor dog.
There's no way, because that's just going to happen. There is no way to reduce shedding, is there?
Well, you can control it.
But
and
get the
you
Terminator?
You can brush it away, at which point then you don't have the tumbleweeds in your house, but the dog is going to lose its winter coat.
Yeah. But glue doesn't work.
No.
Just had to say that because I guarantee you people have tried
Thanks,
that.
Nick. Now
Spray
you're
glue.
just giving ideas.
I'm not giving ideas. It doesn't work. Let's get it out there that that's
Somebody
not a
was
good
just
thing.
flipping the channels and
And so-
all they heard was glue your dog so he doesn't lose his coat, and they kept going. Way
It's
to
not
go.
going to work anyway. It won't work. All right. Well, I don't know. My neighbor Jimmy, who knows? I'm just kidding. He doesn't have a dog anymore. All right. Let's go next to.
He glued it to death.
No, he's a good pet owner. Let's go to Brian. Hi, Brian.
Hey, you don't happen to have your phone there this morning, do you?
I didn't bring it up, and I knew you were going to ask about the kitty, and I did get his cat's a very handsome cat. Handsome cat.
And did you notice a tinge of blue?
Yeah, it's kind of it's grayish blue and big eyes.
Yeah, that's a Russian blue. The girl, the lady. Hey,
Handsome.
how about that young girl, the 17-year-old girl, telling everybody what's going down? I tell you, teen girls are like that. Young women are like that. They'll say, hey, this is the way it is.
What are you talking about?
The girl who called in, who said that she had some problems with the cat and the dog.
Oh yeah, she knew her stuff about the meds. I'll tell you that much. She was impressive, and she has a 17-year-old, so she's doing something right.
No. I thought the young girl called in and said that she was a teen girl and she took care of a cat that was licking its fur.
I don't think she said she has 3 cats and 3 dogs.
Yeah, okay. Well, anyway, she talked about the cat licking his fur. Oh, hey, buddy, you up now? But anyway, so yeah, the thing about the fur, when I thought it's mostly a lot of it's behavioral, and mine's gotten better, as Nick can tell, because out of the lake he used to lick his fur off. I think when he transitioned back to an indoor cat, because when we got him, the vet said he was no more than 3, and he was just coming into his own, and now he's about 5, and he was transitioning and some nerves. And then, of course, one time he did have fleas, and I didn't think he did. And the girl said, oh, what, buddy? And the girl said, yes, he does have fleas. And so we had to start with the front line. That wasn't good enough, so then we went to Revolution. That was good, but I was doing it every month, and I was spilling it. So I go in there and have them do the treatment of Rebecca every 3 months, right, buddy?
And the Prevecta's working, I suppose. So
Yeah, Brevecto's great. It's once every 3 months. It's a topical for cats, oral for dogs. Works well.
Okay, and so when he's talking about the cats and the scratching or the licking, that's why you take your pet to the vet. There's a bunch of potential
lot of
causes,
different
right? I mean,
reasons.
it could be psychological, maybe for some reason, maybe, or it could be a flea
It can be behavioral,
reaction.
it can be fleas, it
skin
can
condition.
be a change in the household, it can be a lot of different things.
Okay, so but almost every case treatable, one way or the other. Some cats get to the point where they lick so much their paws
I think,
go.
well, I can't say that every case is treatable because it depends on the owner.
Oh, right.
Probably every case is treatable. Probably not every owner is going to do what we ask them to do to treat it.
Okay. So it comes down to whether
If
the owner.
the owners don't comply with the recommendations by the doctor, then we can't get anywhere. It's like if
Okay.
you go to the doctor and you have, an infection and they say, please take these antibiotics, and you don't take the antibiotics, and you go back and you're like, I'm still sick. They say, did you take the antibiotics? No.
Right.
Well, they should slap you upside the head and say, get out.
Exactly.
Because if you're not if you come for help and people dispense help and you don't accept the help, done.
Right. Mary Elena back there listens to your advice.
I know she does. She's
She
great.
has an awesome collie.
She texts me, we talk, it's all
Awesome
good.
collie. Milo.
Yeah.
One protein is all Milo
Right?
eats. Chicken,
Right?
which is a
Right?
great.
Sure. And at some point, when her vet thinks, oh my gosh, Milo might have a food allergy, Mary Elena will have a very nice life because she hasn't fed her dog 40 million things. I know, it's going to be amazing.
She's such a good dog. You should see, she has a great picture of the dog smiling.
Yay!
It's just a
I can't wait to
neat,
see it.
neat dog.
Text it to me, Mary Elena.
I'm going to have to tell you, though, that Rocky likes duck, kangaroo, trout, salmon,
Right, because you've given him
chicken,
everything on
lamb.
the shelf. You can spend $100 next time he has
No
food
allergies.
Right,
Doesn't
but
have
when
them.
he gets them,
I think you'd have them by now.
no, they develop over time.
Oh, always? Do they always?
Uh-huh.
Not always, not 100% of the time.
Well,
Some
dogs
people
aren't
don't
born
get
with them.
allergies.
No, correct. But when he does, your vet will love the fact that you're spending $100 on dog food every month.
Oh, gosh. All right, we'll take a break on that note. She's right. We'll be back with more of your calls if you're on hold. Lines open after this. You know,